Hi, and welcome everyone. I'm Jennifer Doliak. I'm a senior fellow at the Niskanen Center and an economics professor at Texas A&M University. This is the second webinar in our 5-part series on how to reduce violent crime. Each hour-long webinar consists of 5 short presentations of research by leading scholars in this space with an emphasis on policy takeaways. We know that many are concerned about recent increases in shootings and homicide rates in many US cities, and hope that this research provides useful guidance for communities that are wondering what they can do to maintain public safety and save lives. If you missed last week's webinar, you can find the recording on the Niskanen website. And of course, we're recording the one today, and so we'll post it as well. We will kick things off here with Monica Deza. Monica, you can go ahead and share your slides in 10 minutes, and the floor is yours.
Okay. Are the slides okay? No? Okay, perfect. All right, well, thank you so much for having me, Jen. I'm Monica Deza. I'm an assistant professor in Hunter College CUNY Graduate Center in MBR. The paper I will present today is Local Access to Mental Health Care and Crime, and this is joint work with Catherine McLean and Keisha Solomon. So first, the purpose of this presentation is to talk about whether mental health care can be a tool to fight violence. So we've all been aware of when we think about tools to fight violence, we think policing, we think incarceration, and yes, they work, but there's all this other realm of policies that are not really intended to fight crime and yet have some effects that are comparable to some extent to criminal justice policies. So, at first, what was our motivation for it? So how can mental illness potentially affect crime? Well, we cannot really disentangle the mechanism because it could offend the offender, the victim, and there's also something called criminalization of mental illness. So from the offender's perspective, you can think that if somebody has paranoia and they think that somebody is continuously following them and they're suspicious of everyone, continuously angry about it, they could potentially be more likely to offend and potentially more likely to commit violent offenses. Now, in terms of the victim, they might be an easy target if they draw attention to themselves, if they have some type of they are speaking more loudly, they are speaking more aggressively, they might be more likely to be targeted for violence as well. And then criminalization of mental illness, what I mean by that is that if you have two individuals and they both commit the exact same identical crime, they do commit burglary, but one of them is mentally ill, he or she might be perceived by the police as being more aggressive or might be perceived as being under some type of under the influence, and therefore that person might be more likely to get arrested. So there's several mechanisms through which mental health care could potentially be linked to crime. Also, not to mention, there's a strong association. 50% of those incarcerated have mental illness, and those are just like the diagnosed mental illness. So before we start talking about the paper, I wanted to discuss a little bit of the history of how we always been concerned about the relationship between the mentally ill and violence, or has this been something that has evolved over time? So between the 60s and the 70s, there was the institutionalization movement that came from a vast public support for humane treatment of the mentally ill. So this led to several state psychiatric hospitals to close, and that resulted in the displacement of patients that would have before been in a psychiatric hospital. Now they'll be displaced to the community. So people will be exposed for the first time to the mentally ill, and they had concerns over whether they impose a threat. At the time, there was limited data that could test empirically whether they were actually a threat. But overall, in the 90s, as crime declined, so did this concern, and people just started being less and less concerned about whether the mentally ill affected crime. So now we go back to the question that we're originally asking. So can mental health care be a tool to fight violence? So first I want to clarify, when we say mental health care, there are several modalities. We're talking here from something as easy as attending a quick meeting with a counselor that will teach you some ways to cope with anger, all the way to being institutionalized for long periods of time in a psychiatric hospital. So which modality of mental health care are we focusing on So this is the first study that focuses on a non-intensive, light-touch, office-based provider who deliver care in a private practice. So by this I mean the local psychiatrist and the psychologist. So obviously this is voluntary. On a weekly by weekly basis. It does not take too much time. It's usually like 1 hour appointments. Therefore, incapacitation is not really an issue, which is usually an issue if you're studying other modalities that actually require a longer period of commitment. In terms of the modalities of mental health care, there is a level measure where level 0 is things like prevention, just attending a talk of how you shouldn't be angry. And level 4 is hospitalization. This type of modality that we're studying, office-based, is considered a level 1 modality. So, so how do we complement our study with previous studies? So we complement the studies on other modalities, hospitalizations, hospitalizations. So there's been studies that have already established the effect of mental health care on crime. This study contributes to say, well, there's a vast of modalities and they all seem to actually have an effect of fight violence. To the extent that different modalities affect different types of patients, that just says that it reduces crime across a wider spectrum of the population. To the extent that it affects different types of modalities that each of them have a different type of cost of attending. It just says that it affects people with different types of treatment adherence. You could think that going to like a full day of treatment is you're less likely to adhere to that treatment than to go into like a 1 hour meeting with a therapist. So overall, several types of mental health care seem to have proven to be an effective tool to fight violence. So this is the method that we use. It's a two-way fixed effect model. Let me show what each is. Okay, so we estimate the effect of, right here, the number of office-based mental health care providers in the county from the previous period. We have the vector of county level characteristics. So there are things like poverty, income, and so on. Stay by year fixed effects, county fixed effects, and the dependent variable here is crime rate for county I and state S in year T. So we are going to use for this regression just the classic uniform crime report data, which has violent and property. Let's see why this is redoing it. Okay, so the findings in this paper is that increasing access to local mental health care decreases crime. So in particular, we find that 10 additional offices reduce crime by, well, 1.6 incidents per 10,000 residents, reduces violent crime by 0.9 incidents per 10,000 residents, and property crime by 0.7 incidents per 10,000 residents. Now, in terms of what they mean as a percentage, so total crime is at 0.4%, violence at 2%, property is at 0.2%. Note that the decrease of violence is the one that is particularly noticeable here. And that makes sense because mental illness potentially affects the way that somebody responds to a situation. So in particular, well, these 10 additional offices represent an 8% increase in the number of offices. So if we were to compute elasticities here, we will be computing a crime office elasticity of 0.05. So does the magnitude make sense? So remember first that we're not comparing here apples, like something like light touch to something slightly harder. We're comparing a full psychiatric hospital where people stay there against their will for long periods of time versus somebody who just goes to speak to the therapist once a week voluntarily. So think about the compliers will be patients with relatively well-managed mental illness, can be treated in an office-based setting, take up new treatment when office opens nearby, already receiving treatment, but local office allows them for a better match. So these people, whereas people with severe mental illness, they might actually just, in order to function, they might actually have to drive to another county to get their medication if needed. So there are people that only seek care when it's closer to them. The hypothesized channel says, like, well, increase access to mental health care, more people seeing mental health care providers, mental health improves, less crime. And so far I've shown you the less crime part, but what about this too? Well, for more people seeing mental health care providers, we find evidence that there's an increase in Google searches for mental health care providers when there's more offices in the neighborhood. There's also a decrease in suicide rates, and there's a decrease in reporting any mental illness. So there is some evidence that mental health is actually improving, and that people are actually trying to seek this type of healthcare. Now, in terms of a policy takeaway, so there's unintended benefits from expanding office-based mental health care workforce. So in our paper, we find that an additional 10 offices will decrease crime rate by 0.4%. The social cost of decreasing crime, well, deterring one homicide is very different from deterring one incident of shoplifting in terms of how much social cost is this costing. So if instead of looking at crime rate as incidents, which will count one homicide versus one robbery, we estimate the expected cost of crime, we'll find that additional 10 offices decrease the cost of crime rate by 2.2%. And this is more in line with the violent crimes because they are usually the ones that are driving the cost. This complements studies that focus on other modalities of mental health care. So modalities that are more intensive, residential, and even cognitive behavioral therapy for youth, as the paper by Sarah Heller. Given the high cost of traditional costs to fight crime, like I'm talking about policing, incarceration, it might be worth to wait this other potentially less costly modalities that could actually decrease crime and that they may actually be to some extent comparable. So those are my policy takeaways, and I think I'm on time.
Wonderful. Thank you so much, Monica. Next up is Santiago Chabon.
Thank you, Jen, for inviting me. And I think you should be seeing my slides now, right?
Perfect, yes.
All right, so a small change of subject from mental health to gangs in Medellin. This is a joint work with Chris Bladman and Ben Lessing, who are at the University of Chicago, and with Gustavo Duncan, who's a colleague here at Universidad de AFIT in Medellin, where I'm based. I'm a professor of economics here at the AFIT. So now I'm going to tell you about this work that we've been doing for about 5 years to try to understand gangs, their involvement in violence, and also how and by what means can states actually kind of challenge the type of control that they exert over communities and the type of regulation that they impose on many aspects of the criminal environment. So in Medellin, most of you know it because of the Escobar cartel in the 90s. Medellin currently is a city where, like a relatively rich city in terms of how developed is Colombia, where virtually every low and middle income neighborhood has a local gang called a combo. We're doing a census of gangs. We've been collecting information on roughly 350 of them, and they control pretty much every centimeter of the city in the territories that where they are present. They have existed for decades and have very well-defined borders. These gangs, beyond being present in all these territories, also regulate many like governance services. They provide, for instance, dispute resolution services for residents. They provide protection services. They charge extortion fees, in principle, in exchange of providing security. These groups also regulate most of the violence in the city. They use violence and regulate it. So they, for instance, forbid homicides in some places, but also, of course, commit homicides. And about 3/4 of all homicides in the city are linked to these gangs. In Medellin, we have roughly between 450 to 600 homicides per year, and roughly 3/4 of them are related to gangs. And in war times, this is like currently we're now in a sort of equilibrium, but in war times, this can go quite high. And for instance, in the last war between gangs in the city in 2009, homicide rates went from 30 to 95 per 100,000 residents in just 2 years. So they explain a lot of the violence in the city. And we, in this study, we're trying to understand the type of control that they exert. How can the state actually counter it? So how does like gang rule respond to state projection of powers? I'm telling you that gangs regulate many aspects of city life in many parts of the city. And what can the state do about it? So we know that gangs govern in principle that they provide services in exchange for a fee. And our impression is that, or our first impression was that gangs were actually just competing with the state in selling protection and other services. They were providing security, providing dispute resolution services in exchange for a fee, competing with the state. If you think like that as a normal duopoly, if one actor, for instance, the state starts to provide better services, then the gang would provide fewer services in the territory they control. But for the gang, governing has some intrinsic benefits and strategic benefits, especially some externalities to the drug trade, because they protect some parts of the city that they control, and then they're going to be able to enjoy the benefits of the drug trade easily, because the state is not going to be as present in that territory as it would be in a context where there are many thefts or many violence in the neighborhood. So which effect dominates is a sort of empirical question. And we're trying to answer this with both a quasi-experiment and an experiment in Medellin. So first, 2 slides on the quasi-experiment. In 1987, the state introduced new borders to provide some specific services related to dispute resolution and security. And these borders created discontinuities, as you see here. There's this border, and you will have 2 neighbors, one on either side of the border, and one of these neighbors is going to be closer to the state than the other. So the creation of these borders introduces a discontinuity in access to state services. We're going to have residents who are otherwise the same, except for one of them is closer to the state than the other. And 30 years after that, we ran a survey and we collected information on both sides of the survey of the border to understand whether the state is actually providing more services and whether the gang is providing fewer services or not. And what we find is that 30 years after the introduction of these borders, being closer to the state implies that you receive more services from the state, but it also implies that you receive more services from the gang. And in particular, this effect concentrates in high-value territories, which are places with high-value drug markets. So gangs, what we see here is that gangs respond strategically to the state provides better services, but then the gang provides more services, especially in those territories that they want to control more, because they enjoy more drug benefits in places where they enjoy more residents' loyalty and there's like more security and so on and so forth. But then we also ran an experiment. We found out a few years ago an intervention of a program that was implemented by the city of Medellin, focusing on service provision only. So they deployed city liaisons to one territory where the gangs were quite strong. And the city liaisons that were deployed by the city were not police agents. They were just like brokers who would help communities access better state services. They were implementing these in one part of the city called La Loma that has a long history of violence and like a strength of the gangs that are present there. And then we worked with the city to scale this up and set up an experiment in the city. We identified 80 gang territories or sectors with strong gang presence. And we randomized half of them to receive a treatment, which was like an escalation of this intervention that I was showing you before. This consisted mainly in 2 things. One, each of these treatment sectors would have a full-time city liaison who would serve as a broker, as I was telling you before. They had like quotas for identifying problems in the city, in the community, making referrals, organizing semi-annual meetings between residents and authorities to try to solve problems, Also help people access the police whenever the people wanted to access them. And we're just present 7 days a week and 24 hours a day, or I would say 10 to 12 hours a day every day for 1.5 years. And the second part of the intervention, these treatment sectors received like an increased attention of city services. So this is one event called Caravana de Convivencia, where the city deployed all their services to these territories and tried to just make it easier for residents to access these services. And what we found, then we also ran a survey here to ask residents whether they were accessing more or fewer services from the state and from the gang. And what we found was that the state was providing fewer services in treatment sectors, or the residents were demanding fewer services from the state, and they were demanding more services from the gang. This result is not precise, but again, this is consistent with a strategic response by the gang to try to respond to more state presence by providing better and more services to the residents of these territories. So broadly, our work suggests like a few insights. One is, I guess the one conclusion that you wouldn't find surprising is that gangs are complex and their motives to govern, to use and regulate violence are not fully understood. And they explain a lot of the violence in Medellin, but also in many cities. In the US, for instance, in cities such as Chicago or New York or Los Angeles, part of the violence is explained by gangs, and we don't understand gangs. We don't understand, well, gang behavior. How do they use violence? How do they regulate violence, and so on and so forth. The second thing is that we thought like the market for protection, charging for extortion fees was the main reason why gangs were ruling and providing services. But what we find now is that it doesn't seem to be the main reason. Gangs provide service and governance to protect other illicit rents, and mainly, for instance, the drug trade in the context of Medellin, the local drug trade. So as a consequence of this, it seems difficult for governments to crowd gangs out of their governing role, because common policy interventions, such as like non-violent interventions, as the one I showed you, or for instance, police crackdowns, may not reduce gang rule, but rather introduce new incentives for gangs to provide other kinds of services and respond strategically to state presence. Then we think, like, besides prosecuting criminal leaders and like governing better, what might states need to do is to tackle gang revenues more directly to try to reduce the structural part of these incentives. But there's one warning here, is that anything that reduces drug and illicit profits or these sort of illicit trends could lead to more extractive and violent gangs, because in principle, the fact that these gangs want to protect their illicit trends is an incentive for them to also be non-violent with residents. They want to earn like a citizen loyalty, and they want to have the neighborhood quiet with no violence, no theft, so that they can enjoy the illicit market. If you try to change that those incentives, gangs might turn to be more extractive and violent, such as gangs in Central America, in cities such as San Salvador or Tegucigalpa. And one last point is that I guess broadly we need more descriptive, theoretical, and empirical work on gangs, because organized crime and street gangs is arguably the largest threat to national security and development in the century ahead. And it's unclear whether the problem is going to be not worse in the coming decades, because many of these organized criminal groups that are created in Latin America emerged during and after wars, and we have a lot of conflict that's stopping and stuff like that. Also, we have that the fact that there are illegal drug markets in every city means that there's an incentive for gang development, creation, and strengthening in every city, because you need someone to provide the good and regulate the market. So it's unclear whether gangs are not going to be developing more and more in every city in the context of illicit drug markets. And also, and this is particularly important for the US, we have massive migration to the US, for instance, from countries in Central America. And we know already that these migration patterns are linked to the creation of gangs. So finally, like, we view our qualitative interviews and the descriptive analysis, the experiment, the quasi-experiment, as proof of concept exercises of the kind of work that we believe is more needed to understand better gangs, to understand better the involvement of gangs in violence, and to understand better what can the state do about that. I think I might have passed 1 minute or two, Jen, so I'm sorry. Thank you.
No problem at all. That was great. Thank you, Santiago. And next up is Deepak Premkumar.
Can everyone see my screen? Awesome. All right. Well, Jen and Niskanen Center, thank you so much for having me to present my research on how public scrutiny impacts police effort. And I'll be drawing on evidence from arrests and crimes after high-profile police killings. So we are all here today to discuss the increase in violent crime that was witnessed in 2020, a trend that's possibly continuing into 2021. And there are a lot of potential determinants that are being discussed today, but this discussion is happening amongst a backdrop of a peculiar year in 2020, but in particular, one that faced lots of civil unrest and a racial reckoning that happened, particularly associated with policing. And this was touched off by several instances of high-profile police killings, namely the murder of George Floyd. And these questions about whether this intensified scrutiny impacts violent crime are not new. So they've been at least going on since 2014, and it's been termed as the Ferguson effect. Now, there have been a series of different articles, some that you'll see recently, but ones that have been going back since at least 2014 that talk about how additional community and media scrutiny impacts policing behavior. And this is one example from the Washington Post, but there have been recent examples from the New York Times speaking about how police officers are quitting in droves as a result of additional scrutiny. But I'll be studying a more generalized example about how it affects actual policing behavior in terms of arrests. To provide a little bit of background on what the Ferguson effect is, it references the death of Michael Brown, an unarmed Black teen, in August of 2014 in Ferguson, Missouri. After he was killed by a Ferguson police officer, there was a large increase in community awareness, media coverage, and protests related to policing. This largely led to expansion of the Black Lives Matter movement. And what we saw was there was also an increase in violent crime in 2015 and 2016. Now, this led former FBI Director James Comey to make the comment that and attribute the increase in violent crime to decreased officer activity, saying that there's a chill wind blowing through American law enforcement over the last year, and that chill wind was the increased focus on police officers and policing more generally. Now, in my paper, what I focus on are three main questions. One, which is, do high-profile police killings lead to reductions in arrests for the involved department? And if they do, these, again, are high-profile events. There's a lot going on. There could be changes in policing behavior, but also changes in offending, community cooperation with the police, and even civilian reportings of crime. So in like the totality of the evidence, do we find that's consistent with public scrutiny being the causal channel for the reduction in arrests? And then finally, which is why we're here today, is what are the broad impacts on violent crime or crime more generally? Now, we'll be drawing from data, crowdsourced data from a website called Fatal Encounters. And again, here's a quick definition of officer-involved fatality, which involves the death of a civilian caused by a police officer. And when we look at data from Fatal Encounters, we find that there's over 1,200 officer-involved fatalities or police killings annually. They collect this data through a variety of different methods: Freedom of Information Act requests, web scraping, and paid researchers. And using their estimates of officer-involved fatalities, they're about 7 to 9% of homicides in the US, broadly defined, are a result of officer-involved fatalities. Now, we won't be using all of those for our study today. We'll be only using the high-profile ones, which is a term I've used repeatedly. That means we'll be focusing on the ones that generate 1,000 news articles or more per incident. How I do this is I scraped a news search engine and determined the number of news articles associated with each police killing. Now, the reason we're not using official government data is that still to this day, estimates of the number of police killed the number of civilians killed by the police are being underreported. Now, what do the characteristics of these high-profile police killings look like? Well, because we're using this high-profile cutoff, ones that are typically discussed in the media align with what we see in our analysis sample. So typically it involves primarily young male civilians that are Black, that are shot by police officers. They're typically unarmed and they're not suffering from behavioral health issues, though about a quarter of them do have some behavioral health issues, which we'll discuss later and obviously intersect with the work that Monica was discussing earlier today. Now we'll be combining that data on officer-involved fatalities with data from the FBI's Uniform Crime Report, which has a near universe of arrests and crime counts that are reported on a monthly basis for most police departments. So we'll be conducting a national analysis. We'll be having over 2,700 police departments, where 52 of them will be experiencing an officer-involved fatality between our sample frame of 2005 and 2016. So we'll be analyzing 72 police killings in total. Now, our analysis will be similar to what is called a difference in difference design. And what that means is we'll be comparing police departments that experience a high-profile police killing versus departments that either experience none between the 2005 and 2016 period, or that experience them but later on in the analysis sample frame. So basically, we're deriving our causal estimate on this idea that the timing of the high-profile police killing is plausibly random. Now, what I'm going to show to you is essentially 9 different difference in difference estimates by arrest category. So these are 9 separate regressions, and they are for each different arrest category and ordered by decreasing level of the social cost of crime. Now, what I'm doing is trying to show how the reductions in arrests may change by crime type. And what we find is that there are no statistically significant reductions in arrests for the more serious offenses. So that includes all of the violent crimes and motor vehicle theft and burglary. However, when we get to theft, what we're starting to see is that there are statistically significant reductions in theft for the 1.5 years after jurisdiction experiences a high-profile police killing. And that reduction in theft is about 7%. So you can think of change in log points as essentially percent divided by 100. And when we focus on the lower level arrests, now these are the least serious offenses. They're also the ones that police officers have the most discretion in choosing whether or not to intervene, such as marijuana sale, disorderly conduct, and marijuana possession. We see substantial and significant reductions in arrests of around 15%. If we were to look at the same figure, but look in terms of violent crime, what we see is almost a flip side, where the increases associated with a high-profile police killing is we see in the aftermath of high-profile police killing, there are substantial increases in violent crime. Now, there's large increases in murder of almost 15%. We see that in robbery of around 12%. And there are also increases that are smaller, but still significant, of motor vehicle theft and theft. And this is incredibly important to realize that although in the aftermath of a high-profile police killing, the reductions are concentrated in the least serious arrests, we still see increases in the most serious crimes. So to summarize, what we find are the reductions are exclusively associated with lower level arrests. I didn't show you this, but there's a lot of work in the paper trying to disentangle where these reductions are coming from. It turns out they occur for both Black and white suspects. Higher profile police killings result in larger effects. And the totality of the evidence points that public scrutiny is mechanism that's really driving officer effort. And when we analyze how these effects change over time, we find that the declines in the least serious arrests are persistent, and they occur for at least 1.5 years after after the high-profile police killing. And when I say persistent, I mean that for marijuana possession, for example, we're seeing reductions of over 30% 1.5 years after these high-profile police killings. And that likely negates theories that officers are just being reassigned from protests to deal with this. However, it may reflect a change that officers are being pulled or choosing to engage less in street-level policing and deciding to stay in their patrol vehicles. We also witnessed large increases in murders and robberies. And though it seems obvious to directly pinpoint them associated with the reductions in policing effort and saying, oh, perhaps the offending response is reacting to a lower apprehension risk judged by the lower amounts of arrest, it could also be the case that they could be reacting to the police killing itself, resulting in a reduction in legal compliance. And this is a large discussion where no one's been quite able to disentangle these two effects yet. Now, what about policy takeaways? What we find in this study is actually consistent what others find with other oversight policies that impose additional monitoring costs on police officers. So what I'm thinking about here are court mandated monitoring from the ACLU or Department of Justice pattern or practice investigations. So we should be wary when imposing these additional monitoring costs, or at least exploring ways in which they can mitigate some of the reductions in arrests and also increases in crime. What we also see is that 1/4 of the high-profile police killings involve civilians that are facing some behavioral health issues. Now, it is important to evaluate how new changes such as having police officers pair with mental health professionals, or perhaps just having more mental health services more generally, such as Monica's presentation, may increase or decrease the level of officer-involved fatalities. We also see that 60% of these deaths involve unarmed civilians, so it's important to understand policies that reduce police use of force. Now, the recent literature has shown a couple different ways. One is increasing the racial and gender diversity of the police department, increasing procedural training for police officers, and delaying the age of entry for when civilians can become police officers. And hopefully, with all of this, we can figure out a way to reduce the number of high-profile police killings and in turn reduce their associated increases with violent crime. All right, thank you, everyone.
All right, thank you. Pat Sharkey, the floor is yours.
Thanks, Jen, and thank you for organizing this. Jen's more active in the summer than any other academic I know, which is kind of cool. But this is a lot of work to bring everybody together. Thanks for doing this. So, all right, so I'm gonna do my best to get us closer on track on time. The challenge here is this is a really complicated intervention. So I'm gonna give you the kind of bird's eye view of what we found. But this is years ago, back in 2013, I was contracted to evaluate this program being run by New York State. And it's a focused deterrence program. And I'll just describe it very quickly. It was carried out in 5 sites across the state. The 3 biggest sites were in New York City, targeted toward high violence neighborhoods. Eligibility criteria were parolees with a violent felony conviction or a firearm arrest in their past. The program consisted of a single, it's called a notification forum or call-in meeting at a local community center. And I'll tell you what happened there in a sec. And it's part of this umbrella of programs that are known as falling under the strategy of focused deterrence or pulling levers. And the theory behind this is that reoffending is less likely if law enforcement, some representatives of law enforcement, combine messages of certainty, swiftness, and severity of punishment, particularly for gun offenses. This was focused on gun offenses in particular, with a message that services and supports are available to people who buy in, to people who agree to go a different route. And this is carried out in a community context that is designed to convey dignity and mutual respect. So the most well-known version of this was David Kennedy's work in the original ceasefire in Boston, which, you know, by lots of different accounts was extremely effective. That was targeted on gangs. This version is targeted on individuals leaving the prison system on parole. Okay, so it consisted of
so Pat, just really quick, I'm not sure we're seeing the slides that you're sharing, so we're still on your cover slide.
Shoot, okay.
It's never clear when to interrupt.
No, I appreciate you interrupting. I don't know why it's not advancing, but let me try again.
Sure.
What do you see now?
Focus deterrence.
Okay.
Beautiful.
How about now? Guiding questions?
Yes.
All right, good. Okay, so now you got me off track, Jen. I'm not going to hit my target of 8 minutes.
No worries.
No, I appreciate that. Okay, so it was a single meeting. They were called in by their parole officer. It was supposed to be voluntary, but when you get told about a meeting by your parole officer, you know, most people attended, so over 80% attendance. And then there were 5 speakers. The first few speakers were representatives of the local police and then federal representative of the ATF, who gave this kind of harsh message of, if you pick up a gun, this is the number of years that you're going into federal prison, and we're going to take you as far as we can from your home, and it's going to be a serious, we're going to go after you. But if you take a different approach, that's when the community leader and service provider come into the discussion and really offer kind of, in some cases, very inspiring messages about what this means to the community, what role this person can play in the community, how much we want to provide help. And so those are the 5 messages. And then there's a chance to speak for the attendees to speak with all the representatives afterward. So I won't go into the literature here, except to say that there's a theory, and it was based on some evidence, that the impact wasn't just about those who came into the meeting, it was also about the message spreading into the community. So that's important because that guided the way that I set up the evaluation. So this was an RCT where we randomized both the neighborhoods where this was implemented and then the individuals within those neighborhoods. In theory, what that allowed me to do was estimate the effect of attending the forum, and it also allowed me to estimate the effect of living in a community where this is being implemented, but not actually attending one of the forums. Turned out that that contagion idea didn't happen at all. There's no evidence of it, so I'm not going to focus on very much on those results, except to say the effect was 0. Okay, so this gave us 4 groups of treatment and controls. These are the neighborhoods. So I did a block randomized design, matching within boroughs, places that had higher and lower levels of eligible attendees. I won't tell you which are the treatment and the control neighborhoods, but anyway, there are 5 sites, 3 in New York City and 1 in Albany, 1 in Schenectady in upstate New York. Okay, the randomization worked. The groups were very, very balanced across the sites. Okay, so I talked about the design, and let me just give the baseline. So in the control group, this is a number who actually had, so this is roughly over about 2,200 people are in the sample overall. And this is 31% violated their parole. So the 2 outcomes that we focused on were parole violations and arrests. Okay, about 31% violated their parole within the first 18 months after the program. About 28% were arrested. Although, as you can see here, very few were arrested for a violent felony. So this program was primarily focused on gun offenses. Very few people were being arrested. This was an extremely safe time in New York. Okay, so the overall impact, this is the estimate that I'll focus on. The punchline is this program had zero effect on arrests. Okay, there was really no evidence that it affected the probability of being arrested in the following 18 months, and no effect on arrests for weapons offenses in particular. It did have an impact on parole violations. So the treatment group had about 4 percentage point lower probability of violating their parole within the following 18 months. And most of that was driven by absconding, which is essentially fleeing the city or fleeing the state, being no longer findable by your parole officer. So there's about a 30% reduction in absconding. And these are all intent to treat effects. Okay, so the treatment on treated effects are going to be a little bit bigger for all of these, but I think the intent to treat is probably the right way to think about the program impact. Okay, so that's the punchline. Big effect on parole violations, mostly driven by absconding. Okay, some subgroups that the people running the program were particularly interested in. There's some impact, some suggestive evidence that the impact was stronger for people just released from prison. There was variation across the sites. I attended meetings in all the sites. They were run effectively in all 5 of the sites. I think the variation was mostly variation by chance. And the only consistent finding was the impact on parole violations across the 5 sites, okay? Okay, no effect on contagion, except the one thing to notice here is that there might have even been a small positive effect on being arrested. That is, if you lived in a neighborhood where this was being implemented, but you did not take part, you were slightly more likely to be arrested in the next 18 months than other people who were eligible, but who were randomly assigned or whose neighborhoods were randomly assigned not to be in the program, okay? That probably takes a few more minutes to explain, but anyway, there's written documentation of this if you want to take another look. Okay, so just a couple months ago, folks from the Chicago Crime Lab, who are here on the bottom left of the screen, went through the non-trivial task of following up and getting data on the people who took part from New York State. This was a challenge, so they basically took my design and then followed up for a longer period to see if the results changed. They found the same thing. Okay, so same effect on violations, and particularly on absconding. The interesting thing here is that it persisted for a while. Okay, so it persisted for past 2 years following the intervention. Okay, so quick summary. This program generated a strong, robust effect on parole violations driven by absconding, no effects on arrests, no effects, no evidence for the contagion of the message beyond those people who took part. Not much different by subgroups, maybe a little bit stronger for individuals recently released, and then substantial variation in results across sites that I attribute to chance, not to substantive differences. How do we think about this? So first off, the effects on violations were strong, but they were not anticipated. So this could be driven by a bunch of things. It could have changed behavior, but it also could have just changed the interaction between parole officers, police officers, and the attendees. No effects on arrests. Again, this could be attributable to changes in behavior, or it could have been attributable to the fact that the possibility that police officers were more closely engaged with these people who took part in the program. And this could potentially explain why people in the treatment neighborhoods who didn't take part actually had higher rates of arrests in the following 18 months. Last conclusion, no evidence for contagion effects. And then how do we think about this? So I just want to spend a few more seconds here to talk about what this means. This is an evaluation of a program, not a theory. And I think this is really important to be clear about, because focused deterrence is this umbrella term, and what was implemented in Boston ceasefire is entirely different than what was implemented in New York State with this individual level programs. So this version had a low dose. It was a single meeting, single point in time, and it was implemented in a city at a moment when gun violence was extremely uncommon. So this was the safest point, in New York City's history when this was implemented. And I think that context is crucial to understanding the outcomes. That said, to really understand what happened requires ethnography. And it just became crystal clear to me, as I was contracted to do this evaluation, I learned as much or more about what was going on from just talking to the people in the room and afterwards. And I'm not an ethnographer, but if we want to understand what is actually happening as these programs are carried out, then we need to do rigorous ethnography. And that became crystal clear from this program. So I'll stop with that. Thanks.
Great, thank you, Pat. And Alicia Modestino, the floor is yours.
Great. Thank you. There we go. I'm Alicia Modestino. I'm the research director for the Dukakis Center for Urban and Regional Policy and an associate professor at Northeastern University with joint appointments like everywhere, but really in econ and public policy. And thanks for inviting me to talk about this topic because it's summer and it's getting covered a lot in the media. And President Biden actually cited our research evidence from Boston as one of the ways that cities and states could use American Rescue Plan funds to curb youth violence. So I'm really happy to talk about this here today. Let me be able to advance my slides here. There we go. So this segues really nicely from what Patrick was just talking about shooting. Just like a lot of American cities, Boston saw a big increase in shootings in 2020. It was a 29% jump. Not too surprisingly, on the right-hand side there, it shows you that this was occurring largely in the same neighborhoods that it usually does, largely in low-income neighborhoods of color like Dorchester, Roxbury, and Mattapan. And of particular concern at the time was the rise in violence among youth. And so in response, then Mayor, now Secretary of Labor, Marty Walsh, used our research evidence to produce from our ongoing evaluation to justify investing an additional $4 million of CARES Act funding into the summer jobs program. And that funding was used to develop in-person and virtual opportunities during the pandemic. But what was really key is the focus on trying to provide similar skill development as prior years with the explicit intention of reducing crime and providing greater opportunity among low-income youth of color, particularly in the wake of the Black Lives Matter movement. And since then, Acting Mayor Kim Janey has continued to expand the program and other youth services as part of this larger effort to have a more peaceful summer. So that just gives you a little bit of the context of what's been going on in Boston. To talk a little bit more about the program, Boston relies on about $10 million, braids together city, state, private funding to connect about 10,000 youth every summer to about 900 local employers. Every summer, the mayor, here's Mayor Walsh, they go out and they drum up support for the program among employers. And a lot of the rationale he's giving there is a lot of the motivation for the program, and it actually kind of resonates with a lot of the things that we found. How does it work? So participants work a maximum about 25 hours a week for a 6-week period. So it's basically right after July 4th through the end of August. They're placed in a job with either a local community-based organization or a nonprofit or a private sector employer. And they're given 20 hours of additional training using a career readiness curriculum that I'll talk about more in a minute. So some of you might be wondering, why would you turn to summer jobs as a way to reduce crime among youth? Here's 4 primary mechanisms that we can think about. And that's also what I'm going to focus on, is thinking about these mechanisms. That's something that's a little unique about this study. So the first is just reducing opportunities to engage in delinquent or criminal behavior. And that's really where the program, all of these summer jobs programs started, was to keep kids off the street, keep them out of trouble. And really, because these programs occur when youth are idle, they're particularly attractive for that reason. But we can also think about the program changing behaviors, right, that are correlated with delinquency and crime. And so either disrupting routine activities like who the kids are hanging out with on the street, whether or not they have any supervision, giving them some socially productive activities where they get supportive relationships with adults and other peers, giving them tasks that help them develop a sense of identity and agency and competency. All these things are really important when you are a teenager, right? You're trying to move into adulthood. And then the career readiness program that I mentioned is actually explicitly trying to develop these behaviors as well. Third, we can also think that this program is going to make crime less attractive, right, by improving your future opportunities. So that's the idea about nothing stops a bullet like a job. They're developing some work readiness skills. that are going to help them get a job in the future. We're boosting academic aspirations, career aspirations, whether that's to attend some kind of career training or go to college. And really the summer jobs program is serving youth who are younger and they're more likely to still be enrolled in school. So they're less likely to have been incarcerated, even if they've been court involved. So we might want to think about summer jobs as kind of intervening at a critical time in the life course for youth that might be likely to engage in violent crime. And then the last thing we really can't discount is that this is a cash transfer program. It totally flies under the radar because it looks like youth development and employment, but it's providing income directly to youth that can reduce the motivation to engage in theft, but can also help reduce poverty. And we actually find in our data that half of the youth in the program are helping to pay for some kind of household bill, whether they're contributing to rent, utility bill, groceries, even their own cell phone, which I would love it if my kids would do that. Since 2015, I've been conducting a multi-year evaluation of the summer jobs program in partnership with the city of Boston. And until recently, there really wasn't a lot of empirical evidence that workforce development programs could improve criminal behavior among young people without like really high touch, high levels of investment. But over the past 5 years, Judd Kessler, myself, Sarah Heller, we've been doing a lot of work in New York, Chicago, Boston, and all of this work has been based on randomized control studies. And so in Boston, like New York, it's an embedded lottery design where the city is using a lottery assignment that happens during the recruitment period there. The kids go through the program mostly in July and August, and then there's a post-observation period. And so we're looking to follow you for, usually it's the next 1 to 2 years after the program. And unlike other studies, my study here is capturing both short-term behavioral changes that happen during the summer. So we run a pre-post program survey that's capturing things like social emotional learning, soft skills, community engagement, changes in academic aspirations to go to college, changes in job readiness skills, like being able to put together a resume and interview, et cetera. And so what we're doing there is then we're linking those short-term things that kids learn in the summer to that longer-term follow-up period where we can see them in the administrative data. And we're linking them to not just criminal arraignment records, but also high school records and employment and wage records. And then we disaggregate all these impacts to focus on how we might be reducing inequality across groups, primarily by socioeconomic and racial status. So what did we find that was so compelling? We've done this across a number of different types of outcomes. The one I'll focus mostly on here is going to be the reduction in crime. And what we found there was that it's largely improvements in soft skills that were linked to a 35% reduction in violent crime and a 29% fall in property crime for the treatment group during the 18 months after the program ended. We also find that youth improve their academic aspirations and also their work habits. So like the number one thing that kids will say when you ask them what they learned during the summer is how to show up on time, which apparently you don't learn in school, but you learn when you're on the job. And that is linked to better attendance. It turns out if you attend more school, that is linked to higher grades. Turns out that all of that is linked to a greater likelihood of graduating from high school on time. And then finally, we've also found some evidence that it boosts employment through job readiness, but mostly that's for opportunity youth who are older, who are done with their schooling, because otherwise largely your summer job ends at the end of the summer. So if we delve into the crime results a little bit, we get a little bit of better understanding of those mechanisms that I was mentioning. So first thing to note is that largely this is impacting violent and property crime, not so much other types of crime. Like we also look at drug crimes, gun crimes, that are not used in a violent crime, and other kinds of crime like disturbing the peace. And those pretty much occur as frequently, even, you might think there's a little slight uptick there, though it's not statistically significant. But we might think that, okay, so these things are still occurring like they were, but maybe they don't get escalated into a violent crime. We also find that there's similar reductions in whether it was a misdemeanor or a felony. And to some extent, though, even though the program really seems to only reduce violent and property crime, it turns out this is really economically meaningful, as you can imagine, because these are the most costly crimes to individuals in society. And so we find even just that 35% reduction in violent crime alone is associated with a cost savings of about $1,800 per youth in terms of victimization costs, not even counting the court costs or incarceration or any of those other things. And that's even throwing out the homicides that occurred in the control group. So super conservative estimate that gives us a return on investment of about 3 to 1 for the summer jobs program. Now, the other thing that we can look at is the timing of this impact. And so I told you one of the really popular kind of mechanisms was thinking about keeping kids off the streets and keeping them incapacitated during the summer. It turns out that's not really what's going on here. And if you talk to participants, they'll say, yeah, well, a lot of crime occurs at night and I'm not working at night. And so really what's happening is that a lot of this is accumulating over time. So that's what this figure is showing you. It's the cumulative treatment effect over time, with each point adding an additional month of data to the prior effect. And you can see the dotted lines there indicating the 95% confidence interval. And really, it's not until like 6 months or so after the start of the program that we see a statistically significant reduction in violent crime for the treatment group relative to the control group. Now, why might this be the case? It could be that we are affecting behaviors during the course of the summer, and that these might be somewhat long lasting. So to delve even further into that, I go back to that pre-post survey data that I mentioned earlier. And that's a survey, again, that's telling us about soft skills, community engagement, whether you want to go to college, whether or not you have these job readiness skills. And then I look to see how these are correlated with that reduction in violent crime. And what I find is that really it's the participants that showed significant gains over the summer across the soft skills. So like managing emotions, resolving conflict with a peer, asking for help. Those are the kids where we see a relative reduction in violent crime. It's not so much correlated with job readiness or academic aspirations. And that might also explain why we see a larger impact on certain subgroups like males who are at risk for crime, and also those who've had a prior arraignment before the start of the program. So just to wrap up, my 5 key policy takeaways for summer jobs as an intervention for reducing crime are the following. So first of all, there's really clear and compelling evidence that summer jobs reduce violent crime. You can find it in Boston, Chicago, New York. We all show very similar effects, very similar timing. And also these programs are oversubscribed. That's why they have random assignments and lotteries. And so they're shovel ready for ARP money, I would say. Second, the timing of the impact and the data on those other outcomes suggest that the program does change behavior in some way. Now, there's other programs that affect social emotional learning that can have similar impacts on violence, like Becoming a Man. And we certainly need more evidence about whether that reduction in violent crime that we're seeing in the first 18 months to 2 years lasts, beyond that 2-year mark without any other kind of intervention to keep it going, right? Like we kind of just have like a 6-week intervention here. And so you might imagine that it could fade out over time. The third is that so these summer jobs programs also yield these other benefits that I mentioned, right? So youth are gaining job experience, they're more likely to graduate from high school. And so really the narrative around summer jobs needs to change. It's not just about staying out of trouble. I know it's like a super sexy result for policymakers and it gets everyone's attention, but a lot of these programs have really shifted from keeping kids out of trouble to trying to give them meaningful employment experiences that are going to help them down the road. And that really lends itself to my fourth point here, that we show that these programs can operate at scale. They already do, right? New York City employs 75,000 kids every summer, Boston 10,000. But quality is somewhat a concern for replication, right? So you need strong relationships with nonprofits and employers. That takes time, and you need to make sure that these are actual job experiences, not just warehousing, to get that change in behavior. And then finally, we've been finding in Boston, it's really time to break down the silos between education and workforce development. Each of these domains reinforces the other, and they're both developmental for youth. And we learned that even giving conditional cash transfers to low-income youth to take community college courses is almost as effective as some of this, the job experiences. And so, it helps to be able to reduce that trade-off between needing a paycheck and investing in the future. So I'll just stop there. Thanks, Jen, for inviting me. This was great, and happy to answer any questions later on.
Wonderful. Thank you so much to all the presenters. I really appreciate your sharing your work and expertise with us. Yes, we obviously don't have time for Q&A today, but I'm sure all the researchers would be happy to answer emails if you have questions or want to try these programs in your city. So thanks again to the presenters. Thanks everyone for coming. I'll see you all same time, same place next week for another round, another set of 5 research talks, and you can find the registration link on the Niskanen Center website. Thanks everybody.